Good afternoon. I hope everyone is having a great day. Today we'll discuss the pros and cons of case-based studying in the classroom. So let's start today by defining what is a case-based study. A case-based study is a factual story that can be used as a teaching tool to help facilitate learning. Case-based studies are everywhere. When you see this logo, you may think fried chicken, but actually KFC has used case-based studies in social media to help further their product in places all over the world, such as India, Europe, and here in America. This is a short YouTube video that we would watch that is approximately 3 minutes long, but it demonstrates how they use case-based study to help them show exactly where their products were and who desired their products and where they needed to push their products. So what can you learn when we talk about case-based studies, and who can learn? Case-based studies can determine the important information to be learned. It identifies the problem. It identifies the possible solutions, and it also forms strategies and ideas for action. It makes decisions and helps to fix the problems. Case-based studies can be used by anyone at any time. So let's talk about some advantages of case-based study. They expose the student to real-life situations. They expose the students to rare situations, and they're low cost, and they develop application skills. So let's talk about some disadvantages in case-based studies. The inability to replicate exact scenario for comparison. It's hard once you have a case-based study, if you need to compare that, any kind of data to get some results, you only have that one case-based study. It's hard to go back and make that happen again to compare those datas. More prone to bias. Once you make a decision and everyone makes a decision about that case base, that decision's usually set. So they can cause a bias situation. It gives a false sense of security. Sometimes you feel like if you've been there and you've done that and you know the case-based study, then you already know the answers, and that really isn't true because things can change in any situation. So let's talk about where we may, as a class, come into contact with case-based study. In dental hygiene, case-based study is very popular. It helps you to get familiar with your patient. It helps you to be in scenarios and situations, not just what you learn in the textbook, but also what you need to know for each individual patient. All patients are different. No one is the same. No situation is the same. So testing through case-based study just gives the teacher another form of, do you know the material? And so that's really important. Case-based study is used in the state board, the national boards, and it's very popular. This used to not be the way that it was taught. It used to be only textbook and information, where now a majority, I would say 60 to 80% of the boards are case-based study. So let's go over a sample case-based study that we may use in dental hygiene. The case-based study will be presented with information, starting with the patient profile. This patient's 57 years old, a white Caucasian male. He's 6'1", he weighs 190, and he's currently in an alcohol rehabilitation program. His chief complaint is that I have bad breath and dry mouth with a bad taste all the time. His partial denture does not fit. His dental history, his last appointment was to fabricate a mandibular removable partial denture. He has no teeth. He has not had his teeth cleaned in about 6 years. After completing his dental work, he lost interest in maintaining his teeth. So another part of the case-based study that's very important is always the medical history. In the medical history, this patient was diagnosed with prostate cancer 5 years ago and underwent chemotherapy and radiation treatments lasting 9 months. He has a family history of cancer, hypertension, depression, cardiovascular disease, and alcoholism. He has numerous allergies to pollen, dust, shellfish, and penicillin. He was recently diagnosed with gout and arthritis. He experiences frequent asthmatic attacks. His daily medications are aspirin, Prozac, Abilify, albuterol, Aleve, and Idocin. His blood pressure was recorded at 155/95. The examination showed that he had lymph nodes that were tender, and in his question now, he consisted that he had bad breath and dry mouth. So first you would study all of the information that they gave you about the patient's history, and this is usually the information that the patient fills out or what is done during an exam. Next, in a case-based study for dental hygiene, you would have the charting information. It would have the teeth information, the bleeding, the pocket depths, the bone loss, anything showing anything pertaining to these teeth would be in the charting that would be recorded. And then the final thing that you had would be the most important, would be the x-rays. You'd have the x-rays of the mouth. You'd also have before and after pictures, before the treatment and after the treatment. So that would be another major thing that you would consider when you're doing a case-based study. So the final part would be the quiz information. There's always quiz questions based off of these case-based studies. And let's just go over a sample quiz here. Okay, this patient experiences xerostoma as a result from what? So it could be from the antimicrobial mouth rinses, cancer treatment, numerous allergies, and depression. And we all know that the number one reason people have xerostomia is cancer treatment. And that patient has experienced cancer and went through 9 months of treatment. So the answer would be B. Number 2, which of the following dental prosthesis has been surgically placed in this patient? Then you can refer back to your x-rays and pictures, and looking back in our x-rays and our pictures, you can evidently see that the patient has had dental implants placed. So the answer would be D, dental implants. The final question, which of the following medication is used to treat gout? Gout is treated by the medication albuterol, and that we learned in pharmacology. So what case-based does is you see that it's taking 3 different areas that you learn in dental hygiene and it's tying it all back together into one case. So that's the important thing of case-based. It's not one particular area most of the time, it's tying it all back together to see if the student really knows what they need to know for treatment. So let's think of some experiences you guys might have had with case-based studies, and we can discuss that. And then also we just want to go back and talk about why case-based is so important. The real life situation is the main concern. It's really good to have that real life situation with patients. You can read it in a textbook all day long, but until you experience it with a patient, it's just not the same. Sometimes you can know the information and then you can be put in a situation, and until you experience it, you really don't know what the feeling is. And that's what case-based studies can do for you. Another thing that's great is when we talk about how it can be rare. Sometimes case-based studies only occur in certain situations, and you may not ever see anything in your lifetime, but through digital case-based studies, you can experience those situations. Case-based studies can be sent through email, they can be on the internet, and that's just where I found the case-based study today that we did was on the internet. So it's a great way to practice for any kind of boards or testing that may come up for students. So today, what we're going to do is I'm going to assign you a case-based study off of the dental website, and you're going to complete the questions for an assessment grade. So I need to know if there are any questions before we get started. All right. So now we'll have our assessment time. And then we'll also review and find out if there's anything that we need to go back over. And we'll talk about anything that you guys need to know for a case-based study if you have any questions. Thank you so much.